Good afternoon and welcome to our first webinar of 2020. And what a year it's been so far. I'm Rhonda Alexander with the Networks of Opportunity for Child Wellbeing at the Vital Village Network. And it's a pleasure to have you all here today for our webinar on operationalizing equity through participatory data storytelling. So thank you so much. So excited to have you all today. So just as we get started, I want to give you an idea of what we're going to hear and experience today. I'm going to go over a few housekeeping items and share just a quick overview of the Vital Village Network and the Networks of Opportunity for Child Wellbeing. And then we're going to focus on two strategies for operationalizing equity in our data work, specifically about applying an equity lens to our use of data and what that looks like in practice around community-driven data collection. For some additional housekeeping tools, slides and a recording of this webinar will be available within a few days on the Now forum, and that can be reached at www.networksofopportunity.org. While I believe you are all muted now, I would just like to remind you to remain muted when you're not speaking. And you can submit questions or comments via the chat box. Lastly, as we work to continue practicing language justice, we will be doing that for this webinar. So if you would like to listen to this webinar in Spanish, please feel free to continue watching on your screen, but you can dial in through your telephone on the line listed on your screen now, and that's also available in the chat box. And again, for submitting questions, please use the dashboard probably on the right-hand side of your screen. You can submit questions at any time. We will have time for Q&A towards the end after we hear from both of our speakers, but you can submit questions there anytime, and we'll also be monitoring the chat box. So just a little bit about the Vital Village Network. We're a network that's committed to maximizing child, family, and community well-being, and have been doing this work in 3 communities in the Boston area since 2010, so coming up on our 10-year anniversary. And we do this work specifically with 3 things in mind. 1, service, learning, and leadership, and what does that look like in the community and uplifting community leadership. Aligning our systems through a trauma-informed lens, and knowing that we are always improving. So we work through an iterative improvement process, as well as collecting and sharing our own data. The Networks of Opportunity for Child Wellbeing is a national initiative that's led by the Vital Village Network. And we really focus on building the capacity and supporting capacity building efforts of communities and coalitions around the country who are focused on health equity and child well-being. And as I mentioned before, you can visit us at the Now Innovation Forum. It's a national network for peers all over the country. There's resources, stories, blogs, etc. Again, you can become a member for free. You can hear past webinars, episodes of our podcast. And as I mentioned earlier, we are continuing to practice language justice. So there's content, much of the content on the Now Innovation Forum is now currently available in Spanish as well. And it wouldn't be right if I didn't talk about our podcast, In the Arena with Now. You can find it wherever you get your podcasts, from Apple to Google, Spotify, Stitcher, and iHeartRadio. And our latest episodes focuses on residents driving change, the Community Solutions Grant Program, and we talk to a Now Learning community member based in Minnesota. And I know it's a little early and things are looking a little different this year, but we'd like to remind you to hold the date for our 2020 National Community Leadership Summit. It will be October 26th and 27th. And not to worry, we are keeping in mind all of travel restrictions. So there'll definitely be some opportunities to engage in a variety of ways. So we hope to see you there. So save that date for us. All righty. And now that I have talked about all the housekeeping and giving you a little bit of background on the Vital Village Network, and now I'm so excited about the panel of speakers and the presentations we have today. We're going to be hearing from Dr. Sujin Conover, who's a senior research analyst here at the Vital Village Network, and Dr. Renee Boynton-Jarrett, who is the founding director of the Vital Village Network. And while Yusuf Ali, our amazing colleague, has done quite a bit of work on this presentation and helping to put together lots of the information you're going to hear today, he is unable to join us. So we'll be hearing from Renee and Sujin. So without further ado, I am going to turn it over to Sujin to begin us off on operationalizing equity in data work. Thanks, Sujin.
Thank you, Rhonda. Can you hear me?
Yes, wonderful. Go right ahead.
I guess that's yes for that. Hi, everyone. Thank you so much for joining us today. Our topic for today is how do we operationalize equity in data work? We do data storytelling to make a positive change by translating information into a compelling narrative. For a lot of us, that positive change is advancing health equity and improving child and family well-being. And when data is a major ingredient to make a compelling story to address various inequity issues, we need to think about what data we can use. We can use publicly available data, often quantitative data, or use data or stories from community to make a key message. And then we need to think about how we can use the data to achieve our goal. So equity matters in this process of data storytelling, either using existing data or collecting new data or stories from community. Why is that? Because integrating equity into the process when we use or collect data allows us to efficiently point out the inequity issue we want to highlight in our story. For example, when we discover hidden patterns in data, we can bring attention to racial or socioeconomic inequity issue we want to highlight in our story. So, for example, when we discover hidden patterns in data, we can bring attention to racial or socioeconomic inequity problems. I will share more about this using examples soon. And if we don't find data relevant to our story, or if we want to lift up community voices, we can collect the data or stories from our community. For this, we can use community-driven approach, which allows us to collect appropriate data and narrative to advance equity. It is basically participatory data storytelling. So what are some strategies to operationalize equity in data storytelling? I would like to share two related to data use and visualization and designing participatory process for data collection. First is applying an equity lens to data use. We can do it by dissecting data. Actually, when we disaggregate data by race and ethnicity or by geography, we can discover hidden patterns in data that could help us address inequity issues. Another strategy is using community-driven participatory approach when collecting data or stories from community. I would like to share a couple of data tool examples from Vital Village's data sharing effort. One is Child Wellbeing Tracker created in Now Learning Community, and the other example is Community Housing Data Tool. So what does applying an equity lens to data use mean? So this is an example showing how disaggregating data by race and ethnicity could address racial health inequity issue. The data here is showing maternal mortality ratio per 10,000 births over time. And what can you see from this data? We see non-Hispanic African American group and American Indian group are showing particularly high maternal mortality ratio. On the other hand, Hispanic and Asian groups are relatively doing well. So we are able to see there is a racial disparity in this data, and we can raise awareness about this issue and then further work for a solution to close this gap. But if we only have the data that is colored in blue here, the average of all races and ethnicities, we are not able to see this racial inequity in the data. So as we saw in the previous slide, being able to see data in different groups of race and ethnicity help us address racial inequity issues. For COVID-19 related data, some state and city agencies are trying to share data disaggregated by race and ethnicity. However, as many of you already know, there is a limitation in the current practice of grouping race or ethnicity. Like in census data, only limited groupings are available in many data systems, but people's self-identified race and ethnicity could be very different. There is an ongoing discussion about how to better reflect complex and diverse racial and ethnic identity, but there is a gap between individuals' experience and data systems so far. And next, this example data is about data disaggregation by geography. Here, we have a data of the average annual prevalence of young children with high blood lead levels in the Boston area. Lead poisoning can have negative impact on children's development and behavior, so this is a serious public health issue. And here we have two data maps here. You see the left one is using county level data, and the right one is using census tract level data. Do you see any difference between the two? County level data does not show what is happening among different neighborhoods. If you look at the data map on the right, darker areas with high blood lead levels are clustered in some neighborhoods, and those are actually less privileged neighborhoods in the city. So the possible underlying issue could be lead paint that may have not been removed older housings, and children are still living in those housings. So from this data, we can tell a story about inequity in housing environments. So being able to see dissected data by small geographic area allows us to see spatial disparities in data if there is any, and identify areas that need our attention and intervention to address the inequity issue. But there is a limitation here as well. Especially with the health data, geographic information of data below county level is not available much from publicly available data sources. Unfortunately, there is no simple solution for this because the confidentiality of individual health information and the importance of geographic information about the data are competing priorities. But for data storytelling, whether we use existing data or collect our own data, having geographic information associated with data is crucial to address various inequity issues that are spread out among different places. Also, I would like to highlight that using a data map is a great way to communicate and highlight the geographic inequity. So now I would like to share another strategy of operationalizing equity in data through a couple of example community practices. Essentially, it can be summarized as a community-driven participatory process. So the first example is the Child Wellbeing Tracker. Vital Village has a national initiative called NOW, Networks of Opportunity for Child Wellbeing, and 10 amazing community-led coalitions working to advance child and family well-being have participated in the Now Learning community. And this Child Wellbeing Tracker is the data product of the leadership from the all coalitions. So what is it? It is a tool to capture the collective actions to promote parent and family engagement of the Now Learning Community Coalition. If you think about child well-being indicators, conventionally we think of children's health or development outcomes. However, the coalitions acknowledge that parents and families play such a critical role to advancing children's well-being, and that they agreed to collectively measure their effort of advancing health equity and child well-being in the context of the parent and family engagement. And another component that I would like to acknowledge here is that throughout the pilot process, some coalitions developed their own data tool to track their progress and process as a part of their data capacity building journey. So coalitions reviewed and shared their data with us around events and activities involving parents and families. Depending on the nature of events and activities, the data was grouped by similar types, as you can see in the colored squares on the slide, and 5 dimensions emerged from the data: communication, knowledge, leadership, service, and connection. So we are sharing the pilot data on the interactive data dashboard on Now Align forum. So let's take a quick look at the data dashboard. So this is the data dashboard. So between June and October 2019, more than 4,000 parents, families, and community participants were engaged by 10 coalitions projects. So as you can see here, data is grouped by 5 dimensions, and this is an interactive tool. So let's take a look at the knowledge dimension, and let's go over training and workshop category. So if we hover one of the bar graphs, so here training workshop, it shows 60% of the total knowledge dimension came from training and workshop category. And if you click this bar graph, it shows more specific information about what events and activities have taken place over the period across the 10 coalitions. And this is another data visualization from this cohort. And this just shows the overall picture of a parent and family engagement effort. This graph shows the flow from each dimension and what category of the activities and programs and events happened, and what type of intended participants were engaged throughout this category. So these are the visualizations that were designed to effectively communicate the data shared by the coalition group with a more broad audience. And also, this is a way to celebrate collective efforts around child well-being across the Now Learning community. So here we have a little announcement. We are inviting coalitions to participate in the next cohort of the Child Wellbeing Tracker. We already have a number of coalitions who shared their interests. So for those who already communicate with us, we will reach out to you very soon. But for any other organizations or coalitions that are hosting events, activities, or programs engaging families, parents, and community residents working to advance child well-being, please let me know. Email me by May 25 if you are interested in participating or learning more about this process. And we're trying to minimize the time commitment from the participants, and also we're planning to have a launch call with the participants and discuss more specific ways to further develop the data dashboard, including how each coalition can use their own data from the data dashboard. And the second example of operationalizing equity in practice by using a community-driven data process is Community Housing Data Tool. By linking health and housing data in Boston area, this tool intends to provide relevant data maps and resources to Boston families. And community residents were heavily involved from its development to lifting up community stories. And now I turn it over to Dr. Renee about this housing data tool's participatory process.
Thanks so much, Sujin. I'm delighted to join you all today to talk more about this community-led housing data tool and how it originated, and acknowledging my colleague, Yusuf Ali, who has worked very hard on this effort over several years. Coretta Scott King said that the greatness of a community is most accurately measured by the compassionate actions of its members. And I just want you to think about that for a moment before we launch into this next phase, because often compassionate actions of community members are not measured when we measure community level data. We're often measuring a series of other factors, but not so much the positive and compassionate actions of its members. And when you think about it, who would raise that as something to be measured? It would come from members of the community as something of value. And often members of the community are not included as equal partners in efforts to design community improvements or measure community contributions or outcomes. So what we'll share about right now is a little bit of the participatory approaches to co-design and action research that have been supported by our community data working group. Oops, looks like I lost control of advancing the slides. Thank you. So in 2015, a volunteer group of community residents, organizational partners, and staff members at Vital Village came together to form a community data work group with the goal of developing a publicly shared community data dashboard. And on this slide, we show the key dimensions that were thought about in terms of the goal of Village Vital Signs, which is what we named the dashboard. The dashboard aimed to track benchmarks for child well-being by having those metrics determined and selected by members of the community. It also aimed to bring a more strengths-based and balanced perspective to neighborhood data, elevate community participation and voice through data storytelling, leverage existing data and resources to explore neighborhood equity and uplift community assets, and begin to ask some new questions, make policy recommendations that could address challenges identified within communities. This is an example of some of the data that we share on our dashboard. It includes a range of measures, from measures of meeting participation and outcomes to measures of neighborhood and community differences. Oops, lost control of sharing the screen. Thank you. Over time, the dashboard's grown to incorporate data on childcare quality, educational outcomes, food resources, as well as equitable neighborhood opportunities for children, civic volunteerism, and network leadership development. From the beginning, participatory approaches to data storytelling were incorporated. So our first project in 2015 involved a digital storytelling workshop for caregivers around their experiences with early childhood education. The next one involved the engagement of fathers who were re-engaging in the lives of their children, telling the story of that journey through digital storytelling experiences. In the middle, you see an example of a student-led photo voice and GIS mapping project that took place around transportation equity. So Boston Public Schools students took photographs of their route to school, highlighting some of the safety challenges, the dangers, and the inequities in their route to school. And these were GIS coded and mapped. And then more recently, we've worked with the Community Data Work Group to launch a food access project that told the story of food insecurity within the Boston community from a variety of perspectives. So this actually ended up leading to an app called Abundance Boston that was a series of actions recommended by that working group, including the ability for community residents to review and provide suggestions and feedback to the places where they received free and low cost meals. Challenging the assumption that because it is charitable giving, community input would not be valued. Here's an example of some of the cross-sector collaboration that has also informed the data dashboard work. For the past 5 years, we've engaged in a participatory action, research, and practice project with the Male Engagement Network. Short form is called MEN. A diverse group of community organizations listed here came together to improve mental well-being for men of color. This group included diverse nonprofits, community development organizations, as well as partners and key stakeholders and residents within the community. And we worked to develop a community-driven and culturally sensitive action plan to improve mental well-being among men of color in Boston using a participatory approach. We supported participatory action research process that launched with a community needs assessment that was authored by a collaborative group of community stakeholders in 2016. And this survey was co-designed by men in the community. Over 300 men participated in the survey, and when exploring what was most stressful, 55% reported that finding affordable housing was extremely or very stressful. 30% reported that that was extremely stressful. It was nearly the highest endorsed stressor next to engagement with police and law enforcement and finding employment. So the community housing tool began with some insights from the community data working group in 2017. This working group also included members of the Men Network who had identified housing as a core area for data sharing and collecting. The aim was both to create a tool that provided access to data that was actionable and could be used to inform policy strategies, but also to provide helpful resources and tools for those who are facing housing insecurity or challenges to their housing quality at that time. The work group also identified several key areas that are often under-resourced and aim to ask more asset-framed questions as opposed to deficit-focused questions. So the group began to identify housing quality, housing conditions, community safety, affordable housing, and housing for single fathers, all as key areas. But they also identified that there were areas that were often missed: residents with asthma, returning citizens to the community, and single fathers. To address the gap, we engaged in a participatory data storytelling workshop. This was called the Cipher. It was an exclusive storytelling event that aimed to spotlight the voices of men whose stories often go unheard. Acknowledging that storytelling can both be painful, but it can be a transformative process in a supportive environment. So that was the design and aim. The stories focused on support that Boston men of color who had incarceration experiences, supporting them in creating video narratives about how this had affected their access to housing, sharing examples of digital videos and stories, leading a story circle to support their story development, and to assist in digital story production using photos, voice recordings, and music. In summary, Participatory approaches have led to the elevation of stories that have not been told and data that is not easily being captured. It also has led to insights about resources, opportunities, and assets within the community that are not routinely acknowledged or measured, and ways that we can share these insights with policy and community stakeholders and researchers to better inform improvements, advocacy efforts, and developed more balanced measures and tools that can be used in the future. Narratives that can capture a more holistic view of the neighborhood, as well as the capacities of the community and the members within. I'll now turn it back to my colleague Sue Jin to talk a little bit about how we have adapted these housing data tools in real time for our COVID-19 response.
Thank you, Renee. So we're going through this a hard time together, COVID-19, and through this community housing data process, we are intending to provide relevant information resources to Boston families, but also recently we try to make this data tool more accessible to community members. So we use a mobile-friendly platform so that community residents who wants to use information and resources from our community housing data tool can easily navigate these on their mobile phone. And on our one of the pages for eviction information and resources, we are adapting with this COVID-19 situation. So we are sharing a lot of information and resources we gathered from the city, but also from the community on our page. So people who wants to know about the eviction related resources who are coping with COVID-19 can actually visit this page and explore information and resources that are all coming from the community. So I will turn it over to Rhonda.
Thank you.
Awesome. Thank you so much. One, I have a couple of questions for you all, but I did see one question coming in the chat box from Sarah, and she just asked if we could share the slide depicting the goals of the data dashboard again. So if we could do that, that would be fantastic. And I'm also going to we'll work to get our subtitles turned off. In the meantime, my first question for you all, as we think about data with traditional data, it's very often deficit-based, right? It's telling us what's wrong. And I would like to know your thoughts or ideas on how do we promote strength-based data use?
I'm happy to begin to answer. I hope my mic is still on. I'm happy to begin
Yes.
to answer. I think that it really begins with making something that is often implicit, explicit. So when we talk about data, we talk about it as if it's neutral and it's factual and accurate. But the data we talk about, the data we measure, the data we have was informed by a series of choices. Someone chose what to measure and what not to measure, and those choices are often informed by how we think the world works. So if you don't believe it's possible for me to walk to the moon, you're not going to choose to measure me walking to the moon. But take that outrageous example and think about a much smaller example. You mentioned strengths and deficits. If we view communities as vulnerable, we are not inclined to think of them as strong. We're not inclined to think of them as places where we have something to learn that we might not already know. And so we have to begin first with challenging our assumptions and making it explicit that data that we have was chosen to be measured, and there was data that was not chosen or seen as valuable or seen as worthy of measurement. That's the most important paradigm shift that I think opens up a lot of opportunity for incorporating a range of exploration.
Awesome. Thank you, Renee. And again, I want to encourage participants. I see questions coming in, so feel free to use that chat box or your dashboard on the right-hand side of your screen to share questions. I have one more question, and again, this is a question for either of you. How do we, given what you've just shared, Renee, how do we better highlight and uplift stories from our own communities?
I can start first. I think the process of Viral Villages, lifting up the stories from the community, we start from listening from the community. So we invite community residents who are experiencing various of hardships, but also share their wisdom, what story that we need to lift up and then raise awareness for certain inequity issues. So I think our efforts building to build a relationship, genuine relationship with the community and maintaining the relationship, constantly engaging community stakeholders, community residents to the every process of the data sharing efforts. So I think that's where that we can lift up the stories that actually matter to the community.
Mm-hmm.
I completely agree with what Sujin said. Remaining involved, moving at the speed of trust is so important. I'll just share a personal example. I shared a lot in this presentation about our data storytelling work, particularly using digital stories. What I didn't share is we had an experience. Well, my first experience of when one of the stories a parent created about their process of seeking out kindergarten enrollment for their child was highly critical of the public school system in the community where we worked. And I was concerned that we might, because we partnered with the school system, that they might not want to partner with us anymore if that story was shared. Um, the challenge was we had invited community members to share their stories, not to have stories that were going to end up being edited or modified by us. And so the story was shared, and actually, a member of the school board thought it was an important story for every member of the school board to hear. I didn't get the negative feedback that I'm sure some of the members may have felt, but I think it is also important to be very clear and transparent about boundaries when you're doing community partnership from the very beginning. And if there are boundaries that are there, they should be made clear. And you have to be prepared for stories to be told in the voice of the storyteller.
Mhm. Thank you both. All right, we have a couple other questions coming in. So our next question, and forgive me if I mispronounce the name, it's from Ishtar. It says, how do you access community members that do not have access to these electronic or smartphone resources to participate in these ways, especially now when the inequities related to the technological divide are so glaring?
It's an excellent question. So one of the things we've done is made it so that you don't have to bring your own technology to a workshop that will help you utilize digital technology to tell your story. These can often be run in 1, 2, or 3 day workshops, but we would borrow from partners or use a computer cluster that a partner organization may have. Or use very simple tools that are provided for people so that technology is not a barrier to creating a story that can be shared and distributed. But I do think it is an ongoing barrier if you don't have access to Wi-Fi and if you don't have access to that digital tool to continue to use for advocacy. So it is an important question.
Great. We have another question from Jane. It says, what can we do if the data we need, for example, race and ethnicity breakdown for health indicators, isn't available or isn't collected in administrative systems? And Sujin, would you like to start with that one?
Yeah, I can. So the question is asking about if there is a data that are not available in the publicly available system.
Right. Mm-hmm.
Yeah, that's a really good question and an important issue because a lot of times we depend on the agencies, right, in terms of getting access to data that we would like to use for our data storytelling. But oftentimes there are a lot of data sets that we want to use, but they are not available, especially from the publicly available sources. And especially when it comes to health data, because of the confidentiality of individuals' health information, it takes a lot of time and resources to actually have an access to that kind of data sets, even if they are available. And then for the health outcomes that are not available, that's a really huge challenge because unless you have a really big resources and time and workforce, collecting data, especially related to health outcomes for uh, a lot of population, is not really feasible. But one thing we can think about is if we want to tell a story from the community, and then if there is a specific health outcome that you want to lift up from the community, you can interview from the community residents related to the health issue that you want to focus on. So actually getting stories and interviews from the community residents, it's their lived experiences, even though it's not um, even though it's not the information collected by the agency, it doesn't mean that it's not valid. So I think even if there is no data that you want to use for certain health outcomes, but if you can talk to your community and then get stories from them and then lift up stories and raise an awareness for a certain health issue, I think it's worth to consider.
Yeah, I really agree with what Sujin has shared. And I would add one or two thoughts. What did we see just happen with COVID-19, right? There was not data being presented by race ethnicity. And what has turned the tide in that? Right? Someone had to point it out that it wasn't being collected and that it wasn't being shared. And then people had to advocate for that.
Mm-hmm.
So I feel like the one of the earlier slides that Sujin shared that with infant mortality, showing the difference between looking at the average and disaggregating by race ethnicity. If you can get a group of community members to make that argument around disaggregating data, we have to kind of plan for the long term. That's one of the things we're learning in a time period like this. You have to envision the data we want to be disaggregated and really start to advocate for that in real time using instances like these to make the case. But I want to highlight one other thing because often when we ask for data, we ask for race ethnicity, right?
Mm-hmm.
Just think about it. We know that there are systemic processes like racism that is actually not measured by your race, ethnicity. Maybe your risk for experience of racism is captured in part by that, but we're not measuring racism. So we also have to advocate for measures of institutional racism and systemic biases that affect us all. So I would encourage you not to stop with your advocacy at asking for race ethnicity measures, but also ask for and start to imagine for long term, how are we going to measure systemic racism? How are we going to measure historical processes that have taken place, so that we can really work towards equity?
Mm-hmm. Thank you both. Again, I want to encourage participants, please continue to submit your questions via the question box on the dashboard. And I have another question for you all, specifically around the participatory process and how might that look differently when we're talking about qualitative versus quantitative data?
I can start. Um, So I think for qualitative data, I think we mostly look at the stories from the community. But I think essentially whether we use qualitative or quantitative data, the core process of a participatory approach is not so different, because what we do is inviting community residents and community partners, and then we brainstorm together what data do we need to raise awareness for equity issues that we're experiencing in our neighborhood. So we start from there, and then we start to think about what quantitative data that we can use and what community stories that we can lift up to share community stories with more broad audience. So I think the type of the data might affect a little bit different the process of just like in more like logistical and technical aspects. For example, like where to locate this quantitative data and is it even available? And then the analyzing way of a quantitative data would be different from qualitative stories from the community. But I think the essence of a participatory process, by listening from the communities and sharing their wisdom, and then letting other people to listen to our stories, what's happening in our neighborhood, I think it's not so different.
Mhm. I completely agree with what Sujin is sharing. And I think a lot of times when we think about community participation and engagement, we shy away from quantitative measures. But what we've used a lot of is like a human-centered design workshop experience to make everyone tap into the way in which they do think like evaluators. But a lot of people have been told you're not good at numbers, you're not good at data, and it's way over your head. But actually, before you can collect anything, you have to make a decision about what you want to collect and what you think is important to measure. And there's a lot of value to those closest to the challenge actually being a part of authoring what is valuable to measure. What are the goals that you have for your neighborhood and your community? And then working through a design process through the steps that get towards a measure. Um, so in the male engagement network work I referenced, that community needs assessment began with a question that was written by one of the residents. He said that the question was, "What makes you great?" That was the first question on this on the needs assessment. That is not a traditional way of starting a needs assessment, but imagine how different it is to begin a survey with a question like that than a question about like what's your biggest hardship.
Mm,
So thinking
mhm.
about the way in which our process and our practices inform the results that we ultimately get and the level of engagement we ultimately get. Beginning with a question like what makes you great completely changes your whole invitation to that experience.
Absolutely. Thank you. And we have some more questions. This one comes from Cynthia. She shared that this is very good work. The data doesn't lie, provided you ask the right questions without infringing on privacy. How did you gain the trust of the men re-entering society to participate?
This was challenging. This was challenging. I think we even underestimated how challenging it would be and how that whole invitation can feel unsafe in many ways. Um, I think we worked very closely with partners in the male engagement network, and those who ultimately participated had close relationships to partner organizations. So there was no one who participated who just kind of came in because they saw a flyer or something like that. It was really facilitated through a network of existing trusting relationships. Um, and those who participated actually had strong suggestions for us about what could be done to improve the process in the future as well. And so I think also being being open to this might not, being open to trying, knowing that it might not, your first time actually might not lead to successful engagement. It is really, um, it is a really stigmatized area in our society, and it's hard to feel that any experience would be in your best interest or with your dignity in mind. So they had several suggestions about how to even elevate dignity more earlier on in the process, and also having people who had participated in a past workshop really being a part of the leadership of a new workshop. So those, they were really great insights. So also being just open to learning.
Thank you. Another question we have from Barbara says, do you have ideas or suggestions for measures of racism? So Renee, this goes back to what you were speaking about earlier around measuring systemic racism. What ideas or suggestions do you have around ways to measure that?
Yeah, so I think for measures of racism, there David Williams has several really well validated measures of interpersonal experiences of racism. Nancy Krieger has several validated, has at least one that I know of validated metric of racism, and I can try and cut and paste these into the chat if I can pull them up. Um, there's also Daria Mendez also has done some writing about institutional racism and ways to capture it. So there are existing measures out there to begin to work from, that you don't have to kind of build it all from scratch. But it is challenging. One thing that could be helpful is also just to go through the exercise of, like, if you're thinking of about institutional racism, perhaps in a school system, right, in terms of disciplinary practices. Well, what actually happens and how does it tend to happen can help you begin to think about how you would go about capturing different elements of the system that might be contributing to that.
Mhm,
You know, ways in which teachers are or are not supported, ways in which information is or is not documented or captured when disciplinary actions are being reported. What is the indication for reporting? Those things.
Awesome. As we are winding down, I have time for just a couple of more questions. So I'm going to try to do our best to get us through what we have here that's come in so far. This one comes from Jennifer. She says, community participation is so critical, but can also be burdensome to the community, especially when their benefits might be nowhere near that of professional researchers like academics. How can community partners and researchers or academics find co-benefits in these processes?
Hmm. It's a great question. I was just thinking of one other thing I wanted to mention about the last question, so I'll just slide it in now. There are also very strong measures of residential segregation, when you and historical. There are also ways to capture historical processes like redlining and other things. So the index of dissimilarity is a good measure of residential segregation. Just putting that out there. That's an area where there's stronger measures. And Dolores Acevedo Garcia has done a lot of that work. Okay, sorry. Now turning my head to this new question that actually I might not remember
Yeah.
it.
She says community participation is critical, but can be burdensome to the community, especially when their benefits are nowhere near that of professional researchers. How can community partners and researchers slash academics find co-benefits in these processes?
Mhm. It's so interesting. I think this question reminds me of so many of the things that we didn't we failed forward on when we started to even have conversations about data in Vital Village Network. So I think there is there can be mutual benefits in the design of a data dashboard, for the community members involved, who are often spending quite a bit of their time outside of work or other commitments working to make their communities better. Um, but I think the trade off in a community academic partnership is that the dashboard might not meet the level that academics are seeking for a variety of things. and the dashboard may stretch in some respects. Um, Beyond some of the like key focus priorities of community members. But I think one way that we've had success in finding mutual benefit has been being open to allowing the community members to really select the focus of the data. So the food access project was a choice that a community member made, and we responded to the enthusiasm and engagement of the work group around that selection. It's similarly with the housing data tool. The challenge for academics is that means that you can't have a grant that says you have to produce this kind of data tool for this purpose if you are going to be dynamically responsive to community identified needs. So there is a challenge to engaging in that degree of a participatory way if you have specific grant goals or funding restrictions. So I think one strategy is to really push funders to see the value of participatory data approaches so that that can be supported, the time and involvement of the community members can be supported, and what's actually developed is really of value.
We have time for one last question. I think this one leads in specifically, I think is a good tie-in or wrap-up, Renee, to what you just said. And this one comes from Sarah. She says, do you have any recommendations about increasing capacity and funding for community participation in data collection and sharing? We so often find resources for collecting data and struggle to find the capacity to share it, analyze it, and get it back to the community. Put it to work for advocacy. So I feel like that was just really tied to what you just said, but if we wanted to have any last thoughts on that.
I think a couple additional ideas I would think of beyond that is just thinking about ways in which data requests that are led by communities could be connected to a lot of the innovative data sharing and technology things that happen, such as a hackathon, right? So could a hackathon be done for a social good and for a social cause that is determined by members of the community? There are community colleges all across the college and other sorts of institutes for higher education. Can there be opportunities for students to use their skills and talents in service to community designed ideas and community developed ideas? So really thinking about how we can build capacity or extend the offerings of existing community institutions to benefit greater portions of the population. I think the funding is really difficult.
Mm, Thank you so much. I know there were a couple of other questions that I couldn't quite get to, but really, really appreciate them. And so we're going to track some of those. I noticed that our colleague has added some resources um, to the chat box, so you can find some links there. Also, I wanted to draw your attention to the screen. There are a variety of resources there, and I think specifically 10 design principles for online data tools for health equity in action from Policy Link. These will also be shared in the post notes, and with the presentation you can find links to these, but you can also find some of these through the Now Innovation Forum on our resource database. You can go there and search for data or principles on data, or any of these keywords you see on the screen, and you'll be able to find those. Again, I want to remind you and reiterate Sujin's invitation for you all to participate in the Child Wellbeing Tracker. So if your coalition is interested, please feel free to email Sujin by May 25th. Her name is on the screen, sujin.conover@bmc.org. We'd love to have as many of you participate as possible. And as we continue our webinar series, our quarterly webinar series, just want to ask you to hold and save the date. We'll be talking about community-driven policy advocacy for systems change in late July, and then creating pathways for community leadership in mid-November. So great opportunities. All of our webinars are recorded, so we hope that you'll be able to join us. And I just want to share another special thank you to Renee and to Jen for sharing. I took away 3 big keywords from this: relationships, advocacy, and telling our stories, so our own stories. So those are the things I took away. Thank you so much. We are right at 2 o'clock. Have a wonderful day. Stay safe,
Yeah.
be well, and we will talk to you soon. Bye, everyone.